the voices of those working on the front lines. These dedicated individuals are uncovering alarming societal and environmental issues that are profoundly affecting our health. It is imperative to hear them out so that we can collaboratively act on adjusting global health strategies. In this session, 5 oral presentations will share insights from their work in the Democratic Republic of Congo, Corsica, Niger, and the Ivory Coast. But I will let actually the next duo of moderators tell you more about it. They will be dividing this session in 2. So I will present to you the first moderator. He is a professor at the University of Geneva, directing the doctoral program in global health. At the University of Geneva, he also leads the GeoHealth of the Institute of Global Health and the Institute for Environmental Sciences. His research focuses on using geospatial methods to optimize health resource allocation in low and middle income countries, and he even integrates climate change into his work. Please give a warm welcome to the first moderator of this session, Professor Nicolas Ray.
Thank you, Ariane. Ladies and gentlemen, good afternoon. Welcome to this special session of the Geneva Health Forum dedicated to presentation from the field under the health and environment thematic of the day. I'm honored to chair this session today with my colleague Micaela Serafini, who will join the floor later on. As Ariane said, we would like at the Geneva Health Forum to amplify the voices of those who implement programs on the ground. And if you were in that room early this morning, you've heard in the opening, Professor Antoine Flau said that the field work is really the DNA of human global health. And so first-hand experiences are crucial for evaluating and refining global health strategy, offering insights that we hope are both tangible and actionable. And so today we are privileged to hear 5 oral presentations that will take us on a global journey, as Ariane mentioned, the countries that you will hear about. We unfortunately are missing one scheduled presentation as Professor Elias Zioua from Tunisia could eventually not make it to Geneva. And so in this session, what we are going to do is, after each presentation, we would like to give you the opportunity to ask questions, 1 or 2 questions, of course, depending on the time we'll have. Can you remind you to keep your questions succinct, 15 seconds maximum, let's say, so that the speakers have time to answer. And also just to mention that our third speaker this afternoon will speak in French. So for those of you who need translation, please ensure that you get your headphone in the back. That will actually also be useful for the final session this evening. So our first talk today, and I'm asking our first 2 speakers that will present together, Fanny Procureur and Krizia Vieri. Please, if you can already join the floor here. So Fanny Procureur has a background in anthropology and has worked in public health research, both at the London School and University College London. And she worked especially in West and East Africa. She's specializing in participatory methods for vulnerable population. Krizia Vieri has a diverse background in public health and biomedical sciences, and she currently serves as a One Health advisor at Médecins du Monde. And so both of our speakers today work at Médecins du Monde. And so if you please can go in the middle here. And as the presentation is put on the screen, yes, you see the title. And so Fanny and Krizia, I'll give you the floor. Thank you.
Thank you. Good morning, everyone. Thank you for assisting at this session. So yeah, today Fanny and myself will present our work in the Democratic Republic of Congo. So just here are the slides. Sorry. So just a small context first. So our project is actually implemented in the National Park of Kahuzi-Biega, in between the province of North Kivu, South Kivu, and Maniema. So the setting is particularly interesting due to its rich biodiversity, but also because it's threatened by human activities and climate change. So the region faces significant environmental destruction, widespread poverty, but as well ongoing ethnic conflict. So for all these reasons, Doctor of the World Belgium decided to set up participatory action research with a One Health approach in the region. So just for the person that are not familiar with the One Health approach, a small definition. So it's an integrated, unifying approach to balance and optimize the health of peoples, animal, and their environment and their ecosystem. It mobilizes multiple sectors, discipline, and communities at various levels of the society to work together to create long-term and sustainable solution. So in the aim of respecting this multi-sectorial approach, Doctor of the World always aim to collaborate with environmental and animal health NGO. We have a strong consortium with the Veterinaries Without Borders, with who we are implemented as well One Health project in Niger. And we try also to seek the local NGO to have the voices of the local communities. And in this case, in this project, is the small NGO called ADMR, which is a small environmental NGO that help planting mainly farm trees on the land of the communities. So as an approach, we always aim to operationalize the One Health in 3 axes. So the first, it's most obviously the communities. We are really an implementing partner, so we always try to work as much with the community. And we aim to a behavioral change. We also work with healthcare professionals from animal, human and environmental health with capacity building. And in a third level, we also aim to advocate. So now I will pass the speech to my colleague that will talk more about our participatory methods.
Thank you, Krizia. So let me pass the slides. So for those who are not familiar with participatory action research, it's a collaborative type of research where you actively involve communities in all the stages of the research, the design, but also the data collection and then the analysis. It's supposedly a very good method to drive social change because communities are directly involved in the decision making. It also allows for a more pertinent or relevant type of results because you foster very innovative and very practical and sustainable solutions. So in our study, we set up One Health committees. We set up 13 of them because we were in 13 villages in the region Krizia presented. And those committees were composed of various profiles. We tried to be very representative of the villages. So they were composed of village elders, religious leaders, farmers. We tried to include female farmers as well. And so with this population, we went through the stages that I'm showing on the screen here. So the first phase is look. So for the look phase, we did an initial diagnostic, which is kind of a baseline, but not really. We're not going to call it a baseline, but it's a diagnostic, let's say, of the One Health issues in the region. And so in this phase, we did a 280 household survey. asking about the symptoms of what people felt. Krizia will tell you in the next slide about these results using the One Health approach. She will do it way better than me. And so after we've done this survey, we organized sessions for the communities to prioritize the issues that they thought were the most impactful in their village. That's the think phase, and then the act phase is basically them planning actions around those priorities. And so after going into the next loop that you see, there's an evaluation. So we're currently in this stage. We've finished we're actually acting now. They're implementing the action plan. And so before going into the next loop, we will evaluate together with the communities how everything went. So we will do it together using different approaches. And so the next slide is Krizia, who will tell you about the results using the One Health approach, so interconnectedness of everything.
Yeah, so as mentioned as Fanny, so we aim here to analyze the results, trying to understand all the link and the synergy in between the issues reported by the community basically. So the first issues, if you look at from a first human health point of view, it's the lack of the low access to healthcare center. So this is really known already in this kind of setting, but there we could hear also the voice of the population and hear why are they have this low access, like for money reason, for logistic reason, like just the path is not practicable to reach the community center, or just the inexistence of a healthcare center, sorry. But mainly what has been reported is the presence of zoonotic symptoms, of zoonotic disease symptoms, and vector-borne disease symptoms. So we have a report of more than 80% of complaint on malaria, and mainly on also 40% on verminosis. And if you look at on the synergy of the approach, we can see through an environmental health, there is deforestation, for instance, to sell actually the charcoal to the city of Bukavu. But also there is illegal hunting, making because we are in this kind of setting that the only sources of protein are people try to look for sources of protein, so it's bring people to make this illegal hunting, making people becoming closer from the wild animals, and then increasing the pathogen spillover. But also due to the lack of sanitary infrastructure, we could also observe water contamination, and as well the destruction of the lands by the stray cattle wandering around, and this created a lot of intra-community conflicts, mainly in between agriculture and cattle raiser, but also a food insecurity, because without the control on the stray cattle, this destroyed the crops. And in the last point of view, the animal health point of view, we also had more than 80% of persons reporting living with their animal, with their cattle, with the poultry or the pigs, because they are scared of robbery. And also this is their job, and this is the sources of income. And as well, one of the also important point is that most of the people, 60% has been reported eating the meat of dead animal with an unknown causes. So they are taking the risk of eating this meat despite the sanitary risk. So of course, all of this leads also to socio-economical problem. We have a raising of household poverty, but also of health inequalities. But what's the most impressive, it's the cycle of violence due to the stress that those communities are living, and a rise also of gender-based violence. So this is just a small part of our result of the initial diagnostic that the population wanted to first work in this first loop. So we are now trying to work with them, and we actually created the action plan according to this problem. And we try to keep this approach, and this really highlights the need of a community approach to really work with the community to find solution and sustainable solution. So thank you. I will pass to my colleague.
Thanks. There's only 2 slides left, I promise. So in terms of perspectives and challenges, so going on to our next loop, we are 2 main challenges we want to address. One is to increase inclusivity, because despite our efforts to include and to be representative of everyone in the villages, we still notice that the voices of women and also indigenous populations, that's how people in the region call them, the PA, are still underrepresented during the sessions that we led. So we want to focus more on improving this. We want to do better in including these voices. And also we want to re-examine the power imbalance, because we know the context in which we're working. We know the history of ethnic conflicts. We know about the history of aid in the region and the expectations that go with it. We also know about the fact that, you know, sorry, I'm using. The consequences of colonialism, of course, they're linked to the history of aid. So we know that the power imbalance is still very much present, and probably everything we've done in those sessions might have been biased by our organization, by our staff as well. So we want to do better in trying to counter this power imbalance. But of course, this might take years, dozens of years. Lastly, we're undergoing a realist evaluation at the moment. So for the ones who are not familiar with it, it's like academic jargon. It's basically comparing the theory when you do a project with what actually happens. You're trying to take into consideration elements of context, and you try to understand mechanisms of your intervention, basically. And we're doing this with the Institute of Tropical Medicine in Antwerp. And lastly, I will give you our last takeaway messages. So the first one is that the environmental challenges that Krizia told you about, they're amplified for vulnerable and precarious populations. And in turn, being vulnerable makes you more likely to adopt behaviors that are risky for your surrounding environment. So this is kind of this circle. This has been very documented in the literature, of course, but we just confirm it. Secondly is the importance of the One Health approach. So working across sectors, we work with Veterinary Without Borders and with this environmental health organization locally. And for us, it's been very crucial to work together. There's no other way to tackle One Health challenges than being in a consortium. Thirdly, reflective community engagement is crucial. Reflective meaning that we need to have this constant critical eye on what we do, the power imbalances, and make sure that we put a lot of effort into countering these. And this cannot be only done in the protocol development. It needs to be done the whole time. And lastly, utilizing participatory action research for innovative and sustainable solutions for us is key. Again, when PAR is led in a very careful manner, we think it's one of the most crucial solutions to address One Health challenges and to find innovative and sustainable solutions. That's it. Thank you.
Please. So we might have time for one question. Who would like to ask one question to Fanny and Krizia? Please. Oh, you need the mic. That's the one. There is one here.
Hello, my name is Kathy Kreppel. I'm from the Institute of Tropical Medicine in Antwerp. And I have a question. You've shown all this big triangle, and you were talking about access to health services. But there has been evidence in other countries that sometimes access to veterinary services is also a problem and actually exacerbating health problems. Have you had any evidence of that as well?
Yeah, so actually access to health veterinary was in existence. So there is small community, how they call that in the DRC, like the small community, like...
Africa?
Yeah.
Yeah, I don't remember the way.
I don't know, like there is a special name that they use in DRC, and they exist, but actually they are poorly accessible, and there is really all this lack of access to veterinary drugs in general. The myth understanding of the use of antibiotics, of on antimicrobial drugs in general. But this part, with the 10 minutes, we could not develop today, of course. But it has been a full, so on the initial diagnostic, we had 3 really big categories, so human, environment, and animal, and this is what's really is more shown on this part, and there it's where Veterinary Without Borders acting and trying to create a network of veterinary and also community worker, if we can say like that.
Thank you very much. Thanks. So our next speakers are Paloma Kiwan and Alessandra Falci. They will also present together. So first on stage, Paloma Kiwan is a third-year PhD student at the Unit of Emerging Viruses at the University of Corsica, Pascal Paoli, and Aix-Marseille University in France. And her main research area focuses on epidemiology and virology, with a particular interest in tick-borne viruses within the One Health approach. And currently, her research is focused on detecting tick-borne viral pathogen in Corsica, particularly the Crimean Congo hemorrhagic fever virus. Alessandra Falci is an infectious diseases epidemiologist by training and trained as medical biologist. In Corsica, which is a hotspot of emerging diseases, so she's brought to the field an innovative interdisciplinary approach by developing a strong link between the veterinary and medical field, carrying out comprehensive surveillances of vectors, wild animals, domestic animals, and human population. She has also developed a research program on vector-borne disease in central Cameroon in collaboration with the University of Buea. Thanks a lot, and I give you the floor.
So, hello everyone. To begin, among the vectors of disease, we have ticks, also known as external parasites. These ticks can feed on the blood of animals and humans and can transmit serious pathogens, such as the virus responsible for the Crimean-Congo hemorrhagic fever, also called CCHF. So it's an enveloped virus of the genus Orthoneurovirus and family Neuroviridae. His RNA genome is divided into 3 segments, resulting in a complex replication process prone to errors, and this leads to 7 different genotypes, as seen on the slide, correlated with their geographic origins. So this emergent virus has been detected in over 30 countries worldwide, with 10,000 to 15,000 cases reported every year. This remarkable distribution is attributed to intensified testing and also to the wide distribution of its primary vector, the Ialoma tick. So these ticks can reach new regions through diverse mechanisms, such as transportation via migratory birds and the legal or illegal animal trade. During spring and summer, this virus can infect a wide range of animals, and as humans, we are also susceptible to infection, either through tick bite or through the contact with infected animals and individuals carrying the virus. In the animal population, CCHF virus causes little to no harm. However, when it infects humans, around 10% may experience symptoms, with a mortality rate reaching up to 30%. And people at risk are those who frequently interact with animals and ticks, such as slaughterhouse workers, veterinarian, field personnel, and farmers. And these population can serve as a sort of early warning system for the spread of the virus. So in Western Europe, there's a growing concern about the emergence of this virus, certainly after the reported cases of disease in Spain and Turkey. And Corsica, which is a Mediterranean island, faces also this risk due to its Mediterranean climate, the location on the avian migratory route, and also the abundance of the Ialoma ticks. Animals, which are considered as good amplifiers, can serve as good indicators of the virus circulation. This is why between 2014 and 2016, antibodies anti-CCHF virus were searched in animals, and detected in 13% of cattle, 2.5% in sheep, and 3.1% in goats. This indicates prior exposure of these animals to this virus. Also, between 2016 and 2020, more than 8,000 ticks were collected on domestic and wild animals and analyzed, but no virus detection was recorded. Since June 2022, we collected more than 5,000 ticks on cattle in slaughterhouses in Corsica, as shown on the map. These ticks were then identified and subjected to molecular analysis, and we had 119 ticks positive at 2 different sites in Corsica. This result marks the first detection of CCHF virus in Corsica and an established circulation in the region. We also sequenced the positive ticks using next-generation sequencing, and results revealed that the circulating strain in Corsica belonged to African genotype 1, with sequences identical to those identified in Senegal, but it differs from the strain that circulates in regions around Corsica, like, for example, Spain, and recently in France. In parallel, we conducted a seroprevalence study involving 2 different groups between October 2022 and July 2023. So we collected more than 2,000 serum from the medical laboratories in Corsica for the first group, which is the general human population. And for the second group, which consisted of individuals at risk due to their occupation, we had 201 participants who underwent capillary blood analysis and responded to a questionnaire covering a wide range of indicators. So after that, the serum of both groups were analyzed using ELISA techniques for the detection of anti-CCHF virus antibodies. As a result, we had 2 participants from the general population who had been positive, and 1 participant from the high-risk population, which was a slaughterhouse worker who has reported being bitten by ticks in Corsica and reported having symptoms after tick bites. Our questionnaire also showed that around 66% of participants at risk have been bitten by ticks at least once in their lifetime in Corsica. And further multi-analysis showed that we had variables that are related to the risk of tick bites, like, for example, farming and a career duration for over 10 years, and also 2 variables that are non-occupational, like, for example, horseback riding and hunting. Till now, we don't have human cases in Corsica. Possible explanations can be inadequate investigation into human infection, certainly as a CCHF disease is often mistaken with the summer flu, and many cases go unnoticed. Also, it could be the circulation of less severe strain. However, similar situations have been seen in other countries, like, for example, in Spain and in Greece, where the first detection of the virus was recorded years prior the emergence of the first case. This is why this shows that this disease should not be underestimated, and we should be aware of possible future autochthonous cases in Corsica. So these findings emphasize the need for ongoing surveillance, public health education, and preventive measures. Also, healthcare providers should include CCHF virus for patients with hemorrhagic fever, certainly those who reported being bitten by ticks, especially in spring and summer. So through these measures, we can strengthen our ability to anticipate and respond to potential outbreaks.
Okay, so thank you, Paloma. So I just have 2 slides, don't worry. Just to introduce a new project called HARSH, aiming to assess the risk of Crimean Congo hemorrhagic fever emergency in southern France. This project will start in October-November 2024, and the global aims will be to elucidate the drivers of Crimean Congo hemorrhagic fever emergency in 2 areas of southern France. Occitanie and Corsica Island, where seropositive animals have been reported and the virus has been detected in ticks collected from cattle this year. So by using a One Health approach, ranging from social science, epidemiology, and virology, the different parts of ARCH will allow us to evaluate the exposure of animal and humans to tick bite and the virus, to characterize tick-animal environment interaction, and to report it, to document perception and practice with respect to health, nature, and agricultural practice among stakeholders, local communities, and scientists. And to improve laboratory method for the detection of the virus to estimate the viral circulation. Overall, this data will be very important to develop a modeling approach to estimate the spatio-temporal determinant and the drivers of the virus transmission at the animal-tick-human interface. So this project has been funded by PRESOD, which is an innovative international initiative with the aim to better understand the risk of emerging zoonotic infectious disease. And it involves 11 partners, and the duration will be of 5 years. So thank you very much. We have ended. In the time, I hope.
Thank you. Is there any questions for Paloma and Alessandra?
Yes. Blaise Jonton, Center for Primary Care in Lausanne. Which message do you give to the general population when they have fever, and exactly the same to the health professionals? Because the problem is that fever is very frequent, and it can be before the hemorrhagic signs.
Hello. We don't have contact with patients. We don't do diagnose in our laboratory. But what we suggest is to include this virus in their diagnostic. So when they have a patient with fever, they should do PCR or other method to detect this virus, but we don't do diagnosis in our laboratory. I don't know if this was the question.
Thank you. If you have other questions, please keep them. We'll see at the end of the session. If we have time, we can come back to the speakers. But thanks a lot.
Okay.
And I'm calling now our third speaker, Dr. Abdulkader Issifi Kolo. Dr. Abdulkader Issifi Kolo is a microbiologist at the Medical and Health Research Center in Niger, currently the head of the National Reference Laboratory for Environmental Monitoring of Poliovirus. He plans to expand his activities towards an environmental microbiology lab that will look into the issue of diseases linked to the consumptions or use of surface water. Dr. Abdulkader, thanks a lot. I give you the floor en français.
Okay, good afternoon. Bonsoir à tous.
Good evening, everyone. Thank you very much. So what I'm going to talk about today is poliovirus. And I'm going to talk about wastewater surveillance to determine vaccine poliovirus circulation and seasonality of enterovirus high detection in Niger. And we got interested in wastewater because we know that everything that we have in our stomach finishes in wastewater. And this wastewater can be used as a source of information regarding community health and the health of our population. Our communication plan is the following. I'm first going to introduce the topic, to talk about enteroviruses in general, then the poliovirus in particular. Then I will talk about the methodology that we used to carry out this study, the results, the discussion, and finally the conclusion. So we know that poliomyelitis is an illness that is part of one that we are fighting against in public health. And there are several serotypes, 1, 2, and 3. And the country was declared exempt or polio-free in 2016. Now, because of the lack of immunization and the issues with health and hygiene, we have observed similar issues emerging that can compare to the wild poliovirus. So first of all, the virus strains. So we now try to determine the specter of poliovirus vaccination that is circulating in the environment, and then we're trying to determine the seasonality of the high detection of these enteroviruses in wastewater. And for that, we created or adapted the following methodology. We visited 11 sites for collecting wastewater. These are open wastewater sites. And 1 liter was collected over the space of several weeks. They were brought to the laboratory and they were concentrated using the PEG 6000 dextran method, according to the advice of the WHO. Then we cultivated them for viruses for several specific cells, the RD and the poliovirus cells as well. We then went on to carry out a PCR in order to determine if we were to identify what kind of poliovirus was going to be identified. And in case of positive results, we went on to the sequencing in order to determine what type of poliovirus we were confronted with. Finally, we obtained a series of results that we proceeded to analyze and establish statistics with. So overall, as you see here, we have the results. And for 519 tested samples, we came up with a 59% of negative results. No enteroviruses identified using the different techniques. Then we had non-polio enteroviruses for 30%, and then 3% for immunization strains that were mutant strains, and through 8% for original immunization strains. So the mutants are important to look at because they can be linked to wild poliovirus. So for the results, it was interesting to look at the seasonality of the detection of enteroviruses, and we observed that during the hot season, we detected less enteroviruses in these samples. And we observed an increase of the enterovirus during the rainy season, so from June to September. And then the detection decreased again during the dry and hot season that follows. We used the SPSS software in order to establish statistics and analyze the link with the seasonality. And we observed significant links between these two parameters. Now, we detected a number of mutants derived from the vaccine. As I said, earlier, this is probably due to the lack of immunization and lack of hygiene, which led us to alert the authorities in order to implement solutions in terms of hygiene and vaccine immunization campaigns in the area that was affected by the disease. Now, we observed the close link between the seasonality, the rainy season, and the high detection of enteroviruses. And this may vary from one year to another because we know that during the dry season, the temperatures can reach up to 45 degrees, which is not an advantage to the survival of these viruses, while during the rainy season, the temperatures are lower, 35 to 37, which is like body temperature, so is more favorable to the virus's survival. Then there is a high percentage of non-polio enteroviruses that were identified, and that's normal because poliovirus represents a small part of the enterovirus type. And the idea is to go towards the characterization of the non-polio enterovirus in order to identify those that are of medical interest and can be found in the environment in order to develop a better strategy to control these transmissible diseases. So to conclude, we detected mutant vaccine-derived polioviruses, so that allowed us to ring the alarm by among the public health system and vaccinate the local population in order to avoid an endemic development of the virus. Then we identified a close link between the rainy season and the high detection of the antivirus. So we increased our awareness-raising activities among the population in order to inform them of what measures to implement and what behavior to have in terms of hygiene. And finally, the high percentage of a non-polio enterovirus that we obtained led us to characterize and identify the enteroviruses of medical interest in order to develop a new strategy to better control the disease. So this is just like antimicrobial resistance or other fields of interest to public health. Thank you very much.
Merci, Dr. Issifi.
Thank you, Dr. Issifi. Y a-t-il des questions?
Merci.
Thank you very much. I'm Mark from City Cancer Challenge, and I studied here at Geneva University. My question regards climate change. With the studies that you have carried out, do you think that in the future we will have to, how should I say this, have to implement systems, surveillance systems that can be adapted to the change of seasons due to climate change? Yes, indeed, because we know that in our countries, one of the main effects of climate change is the increase of disease. We also have observed increased flooding because of changing weather, and what happens is that houses are often flooded, and this, of course, has an impact on the population's health. I know that 2 or 3 years ago there were floods, And that coincided with an increase in typhoid fever, cholera, for example, that are true issues in terms of public health. So the idea is to increase surveillance and create a surveillance system that we can use for this wastewater and that can take into account climate change, because when there is flooding, we have to ensure that sanitation is improved, and our idea is to sensitize health authorities about the risks and carry out vaccination campaigns in order to immunize the population, and raising awareness campaigns in order to avoid epidemics and this kind of sanitation issues. Yes, thank you very much.
Excellent. Thank you so much for all the presenters, and thank you, Nicolas, for the excellent moderation. Now we're going to be jumping into our second half of the panel. A little bit of a summary of what we've just heard. The One Health approach from Fanny and Krizia, which emphasizes nexus of human, animal, and environmental health, aiming for holistic solutions. We also have the tick-borne diseases in Corsica. We just saw how climate, land use, and human behavior contribute to tick-borne diseases like the Crimean Congo hemorrhagic fever. And lastly, we just heard about the environmental surveillance and how it can really serve as a promising strategy to prevent epidemics by monitoring medically relevant infectious pathogens. So for the second part, I will let Micaela take it from here. She is, hold on one second. I need to introduce you properly. Come on. She's a medical and internal medicine specialist trained in Argentina. She has over 18 years of experience in global public health, including fieldwork across Africa, Asia, Middle East, and Latin America. She currently leads the International Committee of the Red Cross Health Unit, overseeing humanitarian health services in over 80 conflict-affected areas. So please welcome Dr. Micaela Serafini to the stage.
Thank you. Thanks for the introduction and the applauses. Let's go directly to our fourth presenter so that we gain time, and at the end we are going to be able probably to get more questions on these very, very interesting presentations. So let me call for the stage to Arlette Dinde. Please come in. She is going to present us very soon after my introduction to her, for which I need to get the passcode. Sorry about that. So Arlette is an early career researcher associated with the Centers of Swiss Research Scientifique in Côte d'Ivoire. Her focus is at the interface of human-wildlife interaction, health, and food security. During the last 3 years, she has been particularly involved in the zoonotic diseases surveillance research in a One Health framework, collaborating closely with the National One Health platform in Côte d'Ivoire. She also contributed to implement biosafety interventions for preventing zoonotic risk diseases among communities at risk through education, training, risk communication, and social behavioral change programs. So, giving you the floor for your introduction of the presentation.
Thank you so much. Good evening, everyone. It's my pleasure today to share with you some data from a research conducted in Côte d'Ivoire under the One Health approach view. It's about trends, gaps, and perspective in wildlife research and health surveillance system. So, as you know, wildlife is important for biodiversity and environmental health, but it also contributes to the emergence of infectious diseases and interaction between wildlife and human due to fragmentation of habitat of wildlife, and also the development of food system, particularly value chain of wild meat consumption, is trying to increase the risk of disease transmission or pathogen spillover. And health surveillance is particularly helpful to prevent and to deal risk related to zoonotic diseases. And also for that, research and adapted governance are also involved to contribute at the interface of human and wildlife. So for this study, our observation was that if while wildlife is important for biodiversity, it exists also some people who are depending for their livelihoods. And these people are at risk of pathogen spillover that can turn into pandemic or epidemics. So we question for this research the situational analysis of the disease surveillance in the wildlife sector from different stakeholders and perspective in Côte d'Ivoire. And the objective of this study is to promote an integrated wildlife surveillance system with One Health by identifying current challenges, gaps, and opportunities. And this research is likely to contribute to the performance of public health system in Côte d'Ivoire. So as methodology, we did a systematic review of research on wildlife conducted in Côte d'Ivoire over 10 years. And we collected about 400 papers, and at the end we included 23 papers for the analysis. We did also interviews with government officers from different sectors at level, local and central level, and institutions included in these interviews were from public health, but also wildlife management. So in terms of results, here you can see the dynamic and mapping of wildlife research in Côte d'Ivoire. We noted that during these last 10 years, wildlife investigation increased, but this research is a bit localized around the protected area and targeted wildlife, mainly primates, but it's not target really interfaces. And also for this research, biodiversity and conservation is dominating than the public health aspect and also the food system. And disease surveillance is little addressed in this research. It's about less than 5% of the research. We observe also poor linkage between sectors and in the collaboration when researchers doing their research. So we also provide a SWOT analysis about the wildlife surveillance. So let me pick some key points to say. So we have a surveillance plan of several diseases in public health and also in animal sectors, but it's not really integrated. And we almost don't have a wildlife disease surveillance. We noted also that there is inadequate hunting regulation, which lead to the non-compliance of these regulation. But we have a great opportunity is the establishment of a national 1F platform which coordinates action of health actions between the different sectors. So as take message, I would like to highlight 3 points. The first one is that we need to push really the wildlife sector in the health system, and also regarding research and regarding the government. The second point is we need a wildlife policy and regulation which is really adapted and consider alternative and trade-off in wildlife meat consumption. And finally, we need really collaboration between sectors when we are investigated as researchers or in the government. So I would like to thank you for your attention here.
Thank you. Thank you very, very much, Arlette. So if there is any question, we are very happy to take it. Any question for Arlette? Yes.
En français, ça va? Ouais.
In French, if you don't mind, it will be better, I guess. Anyhow, my question is the following. Why do you think there are so few links and so few ties? Is it because of a lack of knowledge from both sides, a lack of interest, or a lack of recognition of the importance of the most affected populations? Are there some economic considerations as well? Do you have any hypotheses? Why do we lack these links and ties? What I can say is that wildlife in Ivory Coast has never ever been a priority, whether for government or research. Bearing in mind the different epidemics and the pandemic we went through, we may only say that wildlife has only lately become a priority, and we just realized that wildlife is key if we want to protect human lives. So yes, this might be a beginning of explanation regarding the lack of interest when it comes to research or government's priorities. Furthermore, I think that more and more we realize that wildlife deserves some interest. We have the national plan for health security, which is being developed for the upcoming years, and nowadays we see that wildlife is upper and upper in the agenda, on the agenda. Okay, thank you very much, Arlette. You can slowly leave.
Of thanking Arlette again and calling for our next presenter. So our next presenter is Daniel Soulino. If you could, yes. Great. So Daniel, welcome and looking forward to your presentation. Let me introduce you very briefly. Your bio is in French, so I will try to translate it in English so people don't have to change the speakers. So you're German and Italian origin. You obtained your medical title in the Bâle University, and your doctorate at that time were family risk factors of addiction to tobacco. After that, you continue your studies in Bâle, Zurich, Lausanne, until obtaining your title of specialist and FMH as psychiatrist and psychotherapy, back in 1997, after which you joined as chef de service in addiction in the Department of Mental Health and Psychiatry in the Hôpital Cantonal de Genève back in 2005. Your expertise have a lot to do with addictions, and more particularly the evaluation and the treatment of the automate comportement. Behaviors, fantastic, thank you. The automatized behaviors. You're collaborating with OMS, with OMS, Organisation Mondiale de la Santé, mais en français, désolé. And very much on the validation and development of instruments to be able to survey and detect interventions when it comes to addictions very, very early on. So thank you for being here, and the floor is yours.
Thank you for the invitation. And yes, I'm a psychiatrist, and usually the psychiatrist comes at last. When nothing goes, at least the psychiatrist has a theory. And that's what I try to discuss with you. It's part of a work we did with the International Panel of Behavioral Changes. That's a think tank which tries to propose his approaches to change behavior with regard of environmental damaging behavior. So the question was, could those type of behavior, for example, excessive energy consumption, water consumption, but also other, this type of behavior be correlated to something like addictive behaviors? That's the reason why I was, and I'm still in this panel. So, the animation aren't there anymore. That doesn't matter. So the question is environmentally damaging behavior something like addiction? And if so, and we're trying to make the parallel, could public health strategies which have been proven to be useful against at least some addictions, also be useful to inform policies for preserving environment? So what is addictive behavior? Addictive behavior is a type of behavior which is, which is automatized. That means that instead of thinking about the advantages or the disadvantages of one behavior, it's just following one stimulus. That behavioral program is launched and realized. Usually it's correlated to what we call impulsivity. Impulsivity is to prefer short-term results to those of long-term. So in that sense, we could really make the parallel between addictive behavior, for example, smoking, instead of not smoking, because the advantage of not smoking would be far away. The same with water or energy use. So yes, there is a parallel. Environmental damaging behavior could be called addiction. So to treat addiction, two main axes. One axis is by rational thinking. So thinking about the advantages or the disadvantages of one behavior confronted to a second behavior, consume or not consume. A second and probably for this team more important axis is through non-rational thinking, through automatic thinking. And there's a concept which has been proven to be really useful, especially for smoking. You all probably remember 20 years ago, everywhere was smoke. It was normal to smoke. Denormalization means a process where a usually normal or considered normal behavior becomes not normal, improper, unacceptable, discredited. There are several factors, several aspects which are important. One of the first aspect, or one of the important aspects, is that denormalization has to be visible. We have to declare something as not normal, not wanted in the public, mainly in the public space. That's the first aspect. For example, smoking today is not tolerated, at least in Switzerland or in most European countries, in the public space or in a space where, for example, also children are. Second factor, visibility. Again, we have to denormalize to bring out of sight the behavior we do not want and put on the front of the public exactly the behavior we want to promote. And third, it's not only the individual behavior, but because if it was only individual behavior, we had to intervene for every person. It's also the behavior of the industry itself, which has been done, for example, for the tobacco industry, where some behaviors from some specific behaviors have been declared as non-ethical, not. No. At last, that's my last slide. Again, if we want to denormalize something, it is not sufficient. We need also to clearly declare what has to be the norm. Here is an example, another example of addiction medicine. As you know, in Switzerland, we had a problem in the 1990s with the open drug scenes. You see here an image in the middle. From Zurich, and two types of normalization were decided. One in the environment. You see here at the right the same region, the same place in Zurich where there was at first the second needle park, the Lettner, and now has become a beach, and at the left, that's something also a speciality of Switzerland. The consumption wasn't denormalized itself. What was normalized is a certain type of consumption. Here, in that case, consumption in a medical environment, the heroin-assisted treatment. So, in conclusion, what we can learn from the addiction field is that some behaviors are automatized, have to be addressed through certain strategies we have developed in the addiction field, and normalizing and denormalizing is surely one of those strategies. Thank you for your attention.
Great presentation. Thank you very much. I'm bringing a different angle into it. So, any question?
Hello, thank you very much for your presentation. I just had a question, because I think that when we're tackling a topic like this, we're tackling individual choices, which can be very sensitive. People are usually very much attached to their car, to their meat, to their fashion choices, their biannual trip to somewhere. So how can we address this issue without creating a lot of opposition, or, yeah, that's basically it. That's my question. Thank you.
Yes, that's always the question. That's the question we usually discuss in the field of addiction. How to define a behavior as normal or as accepted. Accepted is probably the better term. Let me again take the example of tobacco. We have to have a public debate or that, and that you can only do with legal products. That's one of the great questions. Why aren't we really able to control illegal substances? Why are we not able to control, for example, cocaine or heroin? Simply because we cannot have a social consensus how to use something right. If we come back, for example, to the cars, we have to have a public debate, much more than we have currently, which car is considered something to show, to propose, and which cars aren't. There's such a discussion currently in France. I think a really useful discussion that some types of cars aren't not anymore tolerated in cities and aren't taxed the double or the triple. That's the way. But to do that, you have to be a public discussion, a public consensus.
Great. Thank you very much. We still have, presenters were very well in their timing, so we still have some time for one or two more questions, if there's questions for any of the 5 presenters. So anyone would like to take that question that we didn't manage during the presentation and ask it now? Okay, there is one question over there. Let's, and if there's another one, we can queue it. So there's one in the end, and then there's one over there. Perfect.
Thank you very much. I have a question for the last second presenter about wildlife. My question is it possible to replace eating wildlife as a source of protein to other domesticated animals, or is it because of the culture? What are the challenges that to stay away from wild animals as a source of meat, and then maybe to go to another domesticated animals and to have them as a source? What was your experience doing this survey or research in your context in Côte d'Ivoire, I think? Thank you very much.
Thank you so much for this question. And I think, bushmeat, wild meat consumption is part of culture and habits. And if something is very difficult to change his habits. And we conducted several surveys among community in Côte d'Ivoire. And if you question, do you think that you can stop to eat bushmeat? More than 60 or 70% will respond no. And I think we should manage this situation step by step. And the first step is to really work on alternatives. Alternatives exist. You have breeding of wild species, but because of the regulation and many issues, we cannot really promote these alternatives in Côte d'Ivoire. So for me, we can work really on alternatives, and then we can work also on communication, behavior change communication aspect. And also, we should also integrate the fact that there is some people who really need of this meat for the nutrition. So we should consider all these aspects when we decide anything in that sector. Thank you.
Great. Thank you very much. There's one question over there, and there's a third one, and then we will start to wrap up. I'm sorry? So there is going to be a continuation of these specific questions, and then we will jump to the other one.
Yeah, no, just to complete, in the context of DRC as well, in the survey, since we are making participatory action research, we are really considering every type of answer, even if it's not the most relevant of the population. And what we could understand as well is like there is culture, like really culture and some practice and beliefs around bushmeat, like for instance, like that, I don't know, like that it's healing the body. And I think that despite all the meat consumption and the fact that it's the only source of protein sometimes, it's all like the hardest part to work actually for behavior change is really the belief that there is around a topic, whatever, and joining as well the last presentation. So we try as well to work on behavioral change, but working on a belief is the hardest part, and it's the last step actually on going forwards. And yeah, that's just what I wanted to complete.
Great for that intervention. So let's go to the last question, that it's over there. So can you identify yourself? Great.
Hi, thank you. Mark again. Sorry. My question is kind of related kind of to everybody, particularly our colleagues at Médecins du Monde and Alette, but also to the other speakers, and really related to the goals of the conservation of biodiversity and the conservation of nature, especially with the 30 for 30 or the 30 by 30, 30% of conservation of land protected by 2030. And so how does this kind of relate with the goals of public health? How do we kind of balance the idea of protecting nature, of being able to really make sure that nature has its place within the world, but also avoiding the risks that that comes with related to public health in terms of zoonotic spillover, human-wildlife conflict, those sort of key public health risks that are associated with the conservation of nature.
Arlette, or they would like? Perfect. Okay. Thanks for the question.
Maybe just to be sure to understand your question, it's more like right now we are putting like the health of humans still in the center, and how to put more like the environmental health more like back to the center of the problem, like of the issue. Is that more like what you are trying to?
I think so, yeah. And part of it, I mean, we talk about there's a lot of big movement in rewilding and trying to make more space for nature. So how do we do that in a just way for trying to avoid public health issues, obviously, but also to make sure that we're not, excluding communities who, play a big role in these types of conservation?
Yeah, it's a bit of a hard question to answer as well, because I think like what we are also trying to aiming to work like when we are working on conservation is also like on the ecosystem-based adaptation. So it's really like to how to adapt in the general climate, and how the community can adapt in this new actually biodiversity around them. And we also try to understand how community can behave if like we are making like a reforestation of a parcel of I don't know, like a fruits tree, like how it's perceived as well as the community. Because the theory is like, for instance, in all conservation acts that we can have and activities that we can make, it's like if we raise again like the density of forests, for instance, like is it gonna really reduce the pathogen spillover? And this also, it's a question that we try to answer, and it's at this moment we can still not answer. And so we try really to, for us, that's the aim of our participatory approach. It's really to, in each step of action, towards the environment, but also toward the behavioral change, how we can see like the changement in the community and not exclude any person of the community. But sometimes it's still difficult, still a human challenge that's still present on the field work. Yeah.
Yeah, and something about imbalance. I think you talked about it. I think if you notice an imbalance, make it visible, document it, I think would be a solution. In our case, we knew that the park was being protected with armed forces. They don't hesitate to shoot if someone from an ethnic minority and from indigenous communities would come too close to the park for hunting. They would definitely be shot for sure. And so we try to document this. We try to kind of talk with those authorities and make sure that we are on we talk in the same language, and that we are looking for a balance. But it is definitely difficult. But yeah, I guess for our case it was making sure that it's well documented and that we try to have equal dialogue with the authorities. Yep.
Great. Thank you. Thanks to all the presenters. I hope I'm going to be fair with the key messages that you managed to transmit to all of us. So in that sense, I think that we went through quite some places. So DRC, Niger, Corsica, Ivory Coast. There is where at the beginning of the session, someone said we need voices to be amplified. I think these 5 examples have amplified those voices coming directly from field experiences. And that brings that policy to implementation, or at least policy to solution and solution to implementation closer in terms of the gap that we perceived in the session before. As key messages, I think the most important ones, and there are going to be few, but I hope that with the weight that this presentation has given us, the first one will be the key role of the community. We do speak about community engagement. We need to know how communities want to be engaged. We have had the example of how to communicate or how to engage with communities from the initial start of the problem statement, from the solution finding until its implementation. And I loved that boucle of look, think, and act. The communities are the ones that know best, and the communities are the ones that will probably tell us best which are the challenges of their daily life when it comes to this complexity of One Health. Obviously, always taking into account that inclusive methodology, so as to make sure that by involving what we say is the community, we are not excluding one important part of it that has a lot to say. The second key message is the interconnectivity. One Health cannot be perceived without that interconnectivity. Environment, animal health, human health, wildlife, the seasonalities, and all those variables that are doing from today the One Health approach the unique way of tackling these challenges that we will have ahead. The third one is the role of surveillance, and we saw it, how important it is to make sure that there is a system of surveillance that can capture those events early on so that the preventive measures are going to be implemented soon enough so as to avoid anything that might come afterwards. Obviously, for surveillance, you need innovation and you need research, and those things come as very important elements. Last but not least, obviously, we spoke about we spoke about the role of the preventive measures, and I've just said so, and those preventive measures linked with the behavioral change. And there is where we can be extremely fast in scientific discoveries, that we will have to make sure that that behavioral change that we expect from others based on the evidence that we have managed to recollect is going to be well understood, are taken forward, because there is where we start playing with beliefs, there is where the beliefs start to be at play. And those are things that we need to take very much into account whenever we're trying to influence that behavioral change for the good health of everyone. There is where knowledge is essential. The timing of that behavioral change becomes essential as well. If we go too fast, we are going to go probably to a confrontation. If we go too slow, we might be skipping something very important. So the piece of that behavioral change becomes extremely important. Knowledge is essential, 5 presentations with different dimensions and knowledge bringing in. And to finish off, another key role has to do with research. They have demonstrated that. If we are not curious enough, we will stay with what we believe is without necessarily the evidence that we need to move even further. I would like to thank the 5 presenters. It has been great to have you here, and I'll give the word back so that we close the session.
Thank you, Micaela. Wonderful, fresh insights that you've provided right now. Thank you so much. And yes, as we just seen, it is so important to take care of our planet, of our environment, because otherwise it's going to come after us. It's going to kick us back. So we do need to start taking care of our home. So before we finish this session, I do want to ask the 2 co-chairs of the day to say some final words of the presentation about the presentations of the field. So the first one is Mr. Bruno Lab. He is an international expert in public health and program management, and he works at the University Hospital of Geneva, focusing on the division of tropical and humanitarian medicine. Let's give him a warm welcome.
Well, a lot has been already said. A very clear and comprehensive wrap-up from Micaela. I think we went through a very dense day. I think it's not about repeating just what was already said, from pollution, science, bridging science and policy, then the talk, very important talk about the impact of climate change on the healthcare system, and then these experiences that we've learned from the 5 presenters. Again, not to repeat, just to say a big thank you, and also to remind to all of you that the day is not over yet. We have a final evening event where we'll have a number of talk and also the award from the Grand Jet de Raxa. Thank you again for your participation, and looking forward to having the same level of engagement for tomorrow and day after tomorrow. Thank you.
Thank you so much. Thank you so much, Mr. Lab. Now, our second keynote is Miss Iris Blum. She is a medical doctor from the Netherlands with a master's degree in global affairs. She's currently researching greenhouse gas mitigation in healthcare systems and its relation with adaptation in the context of climate change. If you were here from early afternoon, you might remember her. So please welcome her back on stage, Miss Iris Blum.
Thanks, everyone. I would very much echo the words that Bruno has shared with you just now. It's been very inspiring to hear all of these sessions. And I think the urgency is clear. We understand the crises that we are facing. Through incredible research that's been presented, we gain a deeper understanding. Evidence is built for interventions. Innovative solutions are brought to the table. And understanding is gained also on the interconnectedness of both the challenges, but also the solutions that we need and that are very much required. The message is clear. The crises that we are facing are health crises. The climate crisis is a health crisis, and we need action and implementation of solutions. So I would ask you to please continue on your work, walk the talk, and encourage others around you to walk that talk with you, because to do this well, we need everyone. So I hope that this is just the start of many conversations, many more conversations, that you will take back to your environments as well. And if I would ask you one thing, I would ask you to take one inspirational thing that you've heard today that you can bring back to your community and implement directly. So please think of that one thing as you walk out of the room today. Thank you so much for the Geneva Health Forum for hosting these very important conversations that we've had today. A big thank you to everyone that's been involved. I think it's a lot of people that have organized, and also everyone that's been taking part in these conversations and engaged today, and all of you here. One more session this evening to look out for, which will provide a detailed insight on the impacts of climate change on our health. I wish you a wonderful rest of the event and a wonderful evening. Thank you very much.
Thank you so much. Now, as you were saying, the event is not over. We do have an exciting program lying ahead, starting at 6 p.m. right here. We will reveal who the winner is for the Grande Jet d'Or Award. And this is a 50,000 euro prize to recognize and support research excellent in tackling relations between pollution and human health. But first, we do need to recharge our energies, right? So as Ms. Blum was saying, walk the talk, go outside, have some coffee, some tea, relax a little bit, have some vitamin D, the little that we have remaining for the day, and we'll see each other again at 6 p.m. again for a very thrilling program ahead.